It's the morning of the King's Fund. I'm excited to take you along with me and explore what's going on in digital health and care, which is the title of the event. Okay, let's go.
Point where we cannot continue working that way. We cannot just watch.
I'm Susan Shalmerdine, consultant radiologist at Great Ormond Street Children's Hospital.
Do you feel like people are generally cautious here today or quite excited about the new wave of digital health?
I think there's a mixture of both, but as a paediatric specialist, I really am quite cautious because a lot of these digital products are not necessarily made with children in mind. There are probably some extra constraints we need to think about.
Children are often exempt from training data sets and from clinical trials. So how do we make sure that AI works for children?
It's a great question. The reality is they don't. But in order to make the step towards that, I think first of all, awareness, which you've raised. Secondly is trying to create more opportunities for data sharing. We're also protective of our data with good reason, but there are safe ways of sharing that, creating networks, creating safe havens for building that data set. And then I guess we also have been thinking in this session, who are our people? So bringing the patient voice along, bringing their parents' voice along, the specialists' voices along, and saying what are the problems that we want to solve with this data set we have.
Thank you so much for talking to me. Who do I have here?
Hello, I'm Will. So I am a medical doctor by background, and we talked about a project in North East London where we were helping a community of patients who otherwise don't engage with their health service, who have known high blood pressure. Almost 500 people a day die from cardiovascular disease, and one of the biggest risk factors to that is high blood pressure. And one of the most, I think, disheartening things is that it's a very preventable one. The only blocker to us actually preventing more heart attacks and strokes is getting people engaged and understanding about their condition. And so our service is really designed to automate as much as possible and give that extra technology layer to be able to do more for more people.
What do you think about this year's event more broadly? Do you think we're asking the questions we need to be asking? Do you think anything's gone unsaid so far?
A key question is still funding for me. If we can get that right, then the three shifts become more inevitable. If we can collectively adopt more of a growth mindset towards innovation and trying new technology, I think we'll start to see the fruits of that soon.
Okay, thank you so much.
That's actually not evolutionary on an international scale.
I think there's an acceptance that the world is changing and general practice will look very different in the future. It needs to be open to thinking how it utilises all of this technology that's coming, but also general practice often is an area where you get grassroots innovation anyway. It's how do we consolidate that to make value at a greater scale.
Do you think that general practice is the medical specialty that's most under threat by AI?
I really don't think so. One of the things I said at the end of the panel is I know that I would want a human being dealing with my family member rather than artificial intelligence, but AI clearly has a role to play to manage demand in a world that people are getting sicker, more complex, etc. I don't think we should lose sight of the fact that actually there is research now showing that AI can offer empathy. I think that's quite interesting, and we should think about that human-AI interaction piece.
I want to touch a little bit on liability because we see some of the same issues cropping up time and time again at these conferences. Do you feel like we're kind of beating a dead horse at these events? Or do you think that we're actually seeing change and seeing different questions being asked?
I think one of the things I talked about on the panel is we are seeing a real shift. So I think we've always had the innovation on the ground, but now what we're seeing is leadership really take note of that innovation on the ground and think about what can we use that can work at scale. I think when it comes to liability, there's elements that we can control, but at the same time, a lot of this will, in some way, play out, and we will see things that we will have to deal with and be reactive to.
Thank you so much for talking to me, and enjoy the rest of your day. So that's a wrap on this year's King's Fund Digital Health and Care Conference. That was genuinely fantastic. I cannot emphasize enough how good a job they have done, how interesting the discussions were. I didn't talk to one person that wasn't utterly enthusiastic about being here and hadn't genuinely learned something new, which can be rare at conferences. Sometimes you're hearing regurgitated thoughts and kind of dead-end discussions. This time, utterly fascinating. Absolutely loved it.